We're going to touch a few topics that raise common questions among patients or people who have relatives or friends that have nosebleeds. So my colleague and I, Dr. Doreen Naku, I am Dr. Victoria Nyeitera.
Good evening, everyone, and welcome to the show.
Okay, so for starters, Dr. Doreen. So we know a nosebleed is bleeding from the nose, really. But could you help us understand some of the things that might cause a nosebleed or some things that might make it worse? Who is more likely to have a nosebleed? And who is less likely to have a nosebleed, I guess?
Okay, thank you, Victoria. So you have asked many questions at the same time. So you clearly said a nosebleed is basically blood coming from your nose, okay? Every part of our body has blood supply of some sort to be alive. So we do have some vessels that come at the front of the nose, but we also have some bigger ones at the back of the nose. So when you ask me what causes a nosebleed, it depends on which nosebleed we are talking about. Who is likely to have which nosebleed? It depends on which kind of nosebleed we are talking about. But some of the common things that will cause a nosebleed, and the very, very frequent one is really a dry nose. So some people will experience a dry nose that is either climate related or change in weather related, or you just basically feel like your nose is dry and itchy, and sometimes it gets crusts, and people get a hanky and try to work in there, and then before you know it, you're triggering a nosebleed. The other people are people with allergies, people who sneeze a lot, especially in the morning, people who have to blow their nose all the time, their nose is wet all the time, so that constant irritation from the sneezing is likely going to give you a nosebleed. We also have people generally with bleeding disorders. They bleed easily, just a small touch, a small scrape, and they're pouring blood. So such people are likely to get nosebleeds, and a few times there may not even be a trigger. Someone just tells you, I'm seated there, no headache, no nothing, and my nose starts bleeding. So that is also a likely cause. The other one is basically the common one for young men: sports. Football, someone elbows you on the nose and you start bleeding, or you have an accident and you bleed through the nose, or you even just have surgery. So all this falls under what we call trauma. So if someone has had surgery recent days, they could spontaneously bleed from the nose. And maybe the last one, which most people fear, is having a tumor in your nose or something abnormal growing in your nose. And it can happen at any age, but this is something that's probably more reserved for older people.
Thank you very much, Dr. Doreen. Sometimes we have very, very young children who present with a nosebleed, and they really don't have allergies, they don't have anything. Could you tell us a bit more about that? Because I'm sure there are parents in the audience who are wondering, why does my baby bleed from the nose?
Yeah, commonly what people will come in complaining about is, I wake up in the morning and the pillow has blood. And I don't know, there's no bleeding, there's nothing. Or he's playing and suddenly he gets a nosebleed. The common thing for children is what we call digital manipulation. So they will get a little itchy, and the first thing they'll do is put in their finger to try and scratch. And children tend to bleed from the front of the nose, unlike adults and older people who tend to bleed from the back of the nose. So that is the common thing. Really, it's allergies, they sneezed, or their nose got itchy, or they just rubbed their nose as they turned in bed, and so they cause a small bit of trauma, and then they bleed.
Thank you. So
I'm going to ask you a question. So in the event, and this is the common thing, so we all know a nosebleed can be scary, and the first thing you're thinking is, what am I going to do? I'm losing so much blood. You don't know how many times patients come in and say, I bled a basin. It was a bucket of blood. And honestly, that's a lot to bleed out. But what can I do, or what can a parent do, or what can an older person do in the event of a nosebleed at home?
Okay. So a nosebleed is something scary, yes, but the majority of nosebleeds are not something to worry about, and it will resolve on its own in a short period of time unless there are other factors behind it. So the most important thing I think to do when you're at home and you start bleeding, or you're at work, you're not really within a healthcare facility, is stay calm, don't panic. And then there are maneuvers that you can do. So either stand up or sit upright. Do not lie down. And then you're going to pinch your nose right there. Open your mouth and lean forward. When your mouth is open, sometimes you get blood dripping at the back of your throat, so just keep spitting it out. And that's the reason we don't want to lean back. You just want to lean forward so you can spit it out, also it comes through the front. If your nose is feeling clogged, like you've been bleeding for some time, you can gently blow it, not violently, to bring out the clots. And then with your mouth open, breathing gently, you're going to pinch your nostrils for 5 to 10 minutes. You can stretch it to 15 minutes. So
maybe you want to
spit out.
So they fit clearly.
Side profile, maybe let's do that. It's seated up, chest forward, mouth open, and okay, for 5 to 10 minutes. After 10 minutes, release and see if you continue bleeding. You can repeat this 2 to 3 times. Now, 10 minutes can feel like such a long time. So if you can, have a timer or have someone who is on the side telling you, okay, now it's been 10 minutes, let's release and reassess. Continue that a few, maybe 2-3 times, and in between your eyes right here you can put ice, so you can have someone just hold ice or a cold bottle of soda, a glass bottle, a plastic bottle, as long as it is something cold from the fridge. We have had people say when you get a nosebleed, they pour cold water on you. There is a bit of science to that because it makes the vessels smaller and you bleed less. And so after you have done your 5, 10, 15 minutes, assess and see if you're still bleeding. The common thing that will happen is the bleeding may still be there but reduced. If it is reduced, repeat that maneuver. If the bleeding has not changed or it is getting worse, then we move on to other steps. Yes. Okay. So those are the simple things you can do or you should do at home when you
So one, don't panic.
Don't panic.
2, position yourself correctly.
Sit up, stand up.
Okay, don't lie back. So pinch the soft part of your nose close together. Breathe through the mouth. Okay, and try not to blow your nose. Okay, so we know the things we should do, but I'm sure there's some things we shouldn't do. And one thing you said is don't lie back.
Don't lie back.
Okay, I'm assuming because when you lie back, you allow blood to flow backwards. And chances are, when you swallow blood, you are going to vomit. But also, in addition, remember we talked about bleeding coming from up front here or bleeding coming from the back. You might miss bleeding from the back, right?
Yes.
So if you lie back, you're going to think, oh, I'm not bleeding anymore, but you are simply swallowing blood.
Or if you're bleeding, you don't know how much,
Or
so
how
you
much
can't
you're bleeding.
assess whether now I need to go to hospital or, oh, we are doing better, let's continue.
Okay. So some of the other donuts that I have are things I've heard from patients do when they get a nosebleed.
Yeah.
The other thing is to plug your nose and many times it's tissue, cotton, get anything you can and just keep putting it up there. And I'm going to say, while you are actively bleeding, don't do that.
Yes.
Because you don't know with how much force you are pushing something in there. You could send it much further back.
Yes.
You could cause more trauma to the nose, so there will be more bleeding.
Yes.
Yes, you're going to argue that when you come to hospital, you see us pack your nose. But there is a more professional or right way to do it, and not everyone gets a nose pack.
Yeah, maybe just to add to that, the blood that comes from the front, that area is very delicate, and that's why when your nose is dry, when you just have a light sneeze, sometimes you can bleed because those vessels are just very delicate. So pushing things up there can make it worse. When you come to hospital, because whoever is seeing you knows where those blood vessels are, they can avoid them or they can cover them with something smooth before they start to push stuff up your nose.
Have you heard of steaming? When you have a nosebleed.
So when you have a nosebleed, some patients say, no, we tried steaming and things got worse. Whereas we've said a dry nose can cause a nosebleed or make it worse. When you steam immediately after or during a nosebleed, it is going to get worse because it's just making your blood vessels wider. Yeah. When there is heat, blood vessels get wider. When it's cold, they become smaller, and so less blood comes through. So instead of steaming, we encourage that when you're actively bleeding, do not steam. You want to apply pressure, and that is why we do that. If it is not stopping, you're safer coming to hospital than now trying all the other maneuvers. So pinch your nose, cold over here, just somewhere between your eyes. Those are the things you can do at home. Other than that, don't try anything else. It gets worse.
Okay, yes. So we know the do's, we know the don'ts. Now the question is, who needs to go to hospital really fast? What is urgent? Yeah. What is emergent? When should I not worry?
What is life-threatening? Yes. So many people will look at a nosebleed and immediately they're scared, and that's why we tell you to calm down and not get overly anxious. That said, there are certain instances where we can worry about a nosebleed.
Yeah.
So we said do that pinching for a few minutes. If you do one try and you assess and it has reduced, do it again and again. But if you're going beyond 15 minutes, there is no change, or each time you check it is the same or it is worse, then you need to go to hospital. Okay? And how do you go to hospital? Pinch your nose along the way and just keep breathing through your mouth. If the blood is trickling down your throat, then it means it's coming from the back, which pinching won't help. And such people are commonly older people, so over 60, people with high blood pressure, people with heart conditions,
diabetes.
It can make the bleeding worse. The other people that we worry about when they get a bleed anywhere, so nosebleed is among those, are people who have bleeding problems, like Dr. Doreen said. So any small cut and you bleed. People who are on medications that make your blood not clot easily, so that is aspirin. There are many people who are on baby aspirin. It's called Ecorine. It has all kinds of names, but aspirin. Second, if you are on warfarin, heparin, if you have had it in the recent past, so the past 2 weeks before the bleeding begins.
I'm going to cut you short there. As we talk about these drugs, these are the common ones that mainly people with high blood pressure, people with heart conditions have had. But I'm also going to include herbs.
Yes. Like which ones?
Oh God, I wish I knew them. I don't know them, but there are all these herbs people take either for things like erectile dysfunction.
Yes.
Herbs that people take for high blood pressure. Herbs that are taken for liver disease.
Yes.
So those herbs, much as you think it's natural medicine, even our formal medicine or Western medicine is prepared from herbs. So some of those herbs actually are likely to worsen a nosebleed. So when you come in, or if you're on any herbs, even if you think it is nothing, I just drink my bottle of this herbal thing, it's best you tell your doctor that, I routinely taking this.
Yes.
Because sometimes we have to keep in mind why you are bleeding much more than usual.
Under the herbs, there's something common that we have in our homes, and people take it. It's amazing, it's wonderful, it has good health benefits, but it causes blood thinning, and that's garlic. We have very many patients, clients come in and they say, no, I take my garlic, it helps me. And garlic is a very good supplement. It is good for hair, it is good for your heart, it is good for your, it's wonderful. But if you have been taking it routinely, it's also important to mention because it thins blood. And if you get a nosebleed or a bleed anywhere else, and you have been taking garlic a lot and you notice the bleeding is not stopping, it could be one of the things that is causing it. Okay, so the other things that should make you consider going to hospital, so we talked about bleeding that is not stopping or worsening, age over 60, other conditions, heart conditions, hypertension, drugs that cause blood thinning, herbs. The other thing you want to consider is a child under 2. It is not going to be easy to do the pinching.
So
and if they're bleeding, so children under 1, it is difficult to control the bleeding from home, but by the time a child under 2 has that kind of bleed, you are worried that it is not going to be easy, one, and to control. Their vessels are more delicate than ours, and they are better managed in the hospital, because if you just keep pushing things up there, it is going to get worse. They're anxious, you're anxious as a parent. Bring the child in and they will be managed.
They're also more likely to swallow the blood.
Yes, and then they'll start vomiting and it causes high pressure in there. Now, one of the other things that we worry about with a nosebleed, and especially if you've been having recurrent nosebleeds, so once every week you bleed, and maybe it is large amounts of blood, is you could be becoming anemic.
Yes.
Or if you've had a sudden large amount of blood loss, even in one nosebleed, there are symptoms that you should look out for, and that one of them is feeling dizzy, lightheaded, feeling like you're going to faint. That is a sign that, one, you have lost a lot of volume in blood, or your hemoglobin is low, so you're becoming anemic. The other sign you want to look out for is a racing heartbeat.
Yes.
And now we need to be careful here, because your heartbeat can race because you're anxious. So if you have calmed down and it is still racing, and it's together with feeling dizzy or faint, you're beginning to sweat, you're feeling cold, you're getting a bit of a headache, you should think about going to hospital. You should go to hospital, because you're losing a lot of blood and you're becoming anemic. The other thing that we consider when we are telling patients go to hospital is if you have pain over your nose. So Dr. Doreen talked about contact spots, and we have young men, you're on the football pitch, bad tackle, and you start to bleed, and usually what happens is they'll fix it on the pitch and the game will continue. Because many times the blood will stop on its own, but if you continue to have pain that is worsening over time, it means you're bleeding in the layers between, and that is not a good thing. So you need to come to hospital. If you continue to bleed and you're getting pain still, we need to come into hospital and make sure you don't have a fracture, you haven't broken anything inside your nose. And then the last reason for coming to hospital is if you've had an accident and it's causing the bleeding. There are many other things that could happen in the nose that we need to assess and make sure that we are not leaving you with a lifelong deformity after the bleeding. So having said
maybe
that,
before you go on there, you've talked about if you've had trauma to the nose, if you are on thinners, age, extreme ages, too old or too young, recurrent bleeds, it's just not stopping. But I think it's also important to note if you have had an operation on your nose.
oh yes,
The recent, and when we say recent, we're usually actually looking to up to 12 weeks. Anywhere in that period, 3 months, and you suddenly get a nosebleed, we must know about it. And that one, we say, do not just allow anyone to manipulate. Try to find your surgeon again, because they will know what they did. If you can't find your surgeon, then try to find an ENT, because you don't want to dislodge anything they could have put in the nose. Maybe the other person is, you do it, everything stops, you're not bleeding anymore, but you can't breathe through your nose.
yes,
Because once the bleeding stops, you should go back to breathing through your nose in basically the regular way you do. But in the event that you can't breathe through your nose after the bleeding has stopped, you should show up, because like Dr. Vicky mentioned, it could be you've developed what we call a hematoma, or a large clot between the layers of the nose, and that we must drain quickly, otherwise we will deform the nose. Yes.
So Dr. Doreen, I wonder, so when the bleeding stops, so someone has done their maneuvers from home and now the bleeding is no more, but you just had a nosebleed, so you're wondering, now what? Do I just sit? Do I touch the nose? Do I not touch the nose? Am I allowed to blow my nose? What should someone do after a nosebleed?
So there are two ways to look at it. One, we could have the patient who has managed to control. It's a one-off. I had a flu, I blew my nose, or I sneezed, and suddenly I'm bleeding. So I do my maneuver, I hold my soft part of the nose, the bleeding stops. So when the bleeding stops, you're out of immediate danger. So now your heart can come down, it shouldn't race anymore, we're on top of this.
We are calm.
But we don't want to trigger it again. That is the key thing here. So one, do not blow your nose. Try not to blow your nose. If you must sneeze, and I mean you can't control a sneeze sometimes, we say sneeze with your mouth open. That means most of the pressure coming from your chest is going to exit through the mouth, which saves you from pressure exiting through your nose. Many times you're thinking, I can't breathe, I think there are clots there, I should blow my nose. But that clot may be the only thing that is holding that vessel from continuing to bleed. So we say, try not to blow your nose for at least 48 hours. If it's feeling itchy, you might want to go to the pharmacy and get something for the itching. Sometimes we will give an antihistamine. You don't want to put anything in your nose. So no nose drops, no nose sprays.
That's very tempting. The temptation is always there.
And because it can feel actually a bit dry after you've had a nosebleed, you want to I just want something in there to wash out that stuff. I'm tired of the smell of blood, but you're going to have to bear the smell of blood for a couple of days. So do not put anything in your nose, because you don't know what will trigger a bleed again. And then we want to say sleep on the side, on your side. You don't want to sleep up that way because you don't know when it will start again, and then or you might get a clot that dislodges. So you want to sleep either on the side or you sleep facing down, because when you face down, automatically your head will go to the side. I don't know if I'm missing anything key.
Maybe the other thing you don't want to do is lift anything heavy.
Straining.
If you're constipated, you might want to start drinking a lot, eat your pawpaws, because every time you exert a lot, you get high pressure in the nose, and then you can open up those blood vessels. One other thing that they shouldn't do, maybe we talked about, don't put anything in the nose, don't put your fingers. Sometimes, even without putting in the nose, when you just rub over it, you trigger, especially if it's because of weak blood vessels. Don't put any sprays. Then don't drink very hot things in the immediate period after. So for at least 2 hours, try and drink cold things. Refrigerated is the best, because we said cold things make blood vessels small, hot things make blood vessels much bigger.
Which is also don't steam.
Yes, don't steam. Now, because of that sensation, you feel like things are dry, the temptation to steam is there. Luckily for us now, masks are an everyday thing.
Yes.
Put on your mask, you will breathe out the humid air, and you'll breathe back in with the moisture. It actually helps. Some people don't like the masks. It makes them feel uncomfortable. They say, I'm not breathing better. It will humidify you to an extent that it won't trigger another bleed, but you'll get a sense of comfort. Okay? I've had some patients get Vicks King or Rob, and they put it around here for relief. As long as it's not going inside, and it's just around, it is okay. The worry though is, as you're doing the around, you're moving the nose, you're causing irritation, especially in a child who blood vessels are right there. You don't want to be upsetting things. Sometimes when you come to hospital, the doctor will give you instructions on how to apply some creams in the nose, and that's okay as long as it has been given by a medical practitioner, preferably an ENT, who will explain this is where the vessels are, this side there are no vessels, do it like this, maybe use a small finger, but don't try this at home on your own without advice. Yes.
Okay, I think that was a very extended discussion on a nosebleed, and I'm sure every parent now can, or at least every adult can at least try to give first aid for a nosebleed.
So key take-home messages: stay calm, pinch your nose in an upright position, seated or standing. Cold is better than hot. And the things that should bring you to hospital: excessive bleeding, bleeding that is not stopping, if you have other conditions or you're on medications that might worsen the bleeding, and if you're feeling faint, dizzy or weak.
I'm going to say, if you are worried, you don't have any of these things, but you are worried, seek medical advice. It's always best. At least you will know for sure whether you should be concerned or when you should get concerned. All right.
Thank you very much for tuning in. We will see you next time on Health and Lifestyle on AIT TV. Good evening.
Watching AIT TV, empowering you.